The Western Cape Premier Winde is expected to meet with Cabinet to discuss new COVID-19 case increases. Now, in the past weeks, the province has begun to see a resurgence of COVID-19 cases in that province. Cape Town has started seeing more than 2,000 infections daily. Joining us now to discuss how the province is planning to curb another COVID-19 spread is Winde, the Premier of the Western Cape, and he joins us live now. Premier, a very good morning to you. Firstly, tell us about these community transmissions, because that is a cause for concern. Community infections, then, the triggers, they start, your red flags start showing, isn't it?
Correct. Good morning. Thank you very much for the opportunity. And yes, we've seen it now over the last couple of weeks in the garden route specifically. We saw numbers started to go up. Initially, what we called these little bushfires, small transmissions, or maybe even little super spreader events, which could have been driven by a funeral or could have been driven by a wedding or any kind of gathering. And what happened in the garden route is that moved into community. So as soon as community transmission starts happening, it's much harder to contain. And as we've seen over the last few weeks, those numbers have continually started to climb, and that's why we really are clamping down, asking citizens, they really need to play their part. What we have to do is avert lockdown, at all costs. Our economy cannot afford another lockdown, so we have to bring in whatever measures we have to slow down the spread. We've done it before, so we need to just do it again. Although we do notice fatigue, and that's why my call to the citizens is, please, we know what to do. Let's slow it down. And then, of course, we started seeing it now in the last 2 weeks in the city, in regions of the city of Cape Town, slowly starting to see some of those numbers rising, where in the last 2.5 months, 3 months, we've continually seen a drop off. And now suddenly in the last 2 weeks, we're starting to see those numbers pick up again.
Yeah.
And we need to slow it down now, because we're moving into the summer holiday season, where we need to have some semblance of economic clawback. We've got people going to be coming here from around the country, and hopefully some people from around the world. So we need to make sure that we are managing that spread as best we can.
You talk about a lockdown, Premier. I'm going to engage you on that a little later. Talk to us about the number of active cases right now within the province. Do you have those figures at the moment?
Correct. So in the metro itself, I got 4,858 active cases. It's about 100. It's 106 cases per 100,000. In the garden route, I've got 3,948 cases, and that's a bit higher now. That's 638 cases per 100,000, and that's why we really are focusing on the garden route. We've got to slow it down in the garden route, but also we've seen that rise now in the metro of the city of Cape Town itself. In our other regions, much lower cases. We've got to keep those where they are. But those are the two regions that concern me at the moment, the garden route and the city itself.
Yeah, Premier, it's a resurgence. I wonder whether you are at a stage where you are already talking about experiencing a second wave. Is that effectively where the province is? The Eastern Cape confirming on this channel on Sunday that they actually are right now dealing with a second wave. Is that the similar case for you?
So it's definitely not for the province and not for the city. The garden route numbers are much higher. So, yeah, I suppose, you could term it as that. But we prefer not to use that. We prefer to use the resurgence word. It means that if we've got more than 20% growth week on week on our numbers, and we manage those week on week numbers, we sort of use them as our indicator. And everything that we do is to make sure that our hospitals are managing. So at the moment, I got 1,165 people in hospital, with 203 getting high care or ICU care. The city of Cape Town, we are still fine, but that's why we are voicing our concern. We need to make sure that our hospitals can cope. And I think the second whammy is that we've started to bring back the hospital and healthcare that was missing during the 8 months previous to this, where we started pushing out medical procedures, etc. We've just started to bring them back in again So we've got to manage our hospital system so that we can continue giving the proper, healthcare that is needed to people that have been waiting for a while for it.
Yeah, Premier, I'm going to link two questions and make them one. The lockdown you touched on earlier, there is something that you have been talking about. Apparently, either it's called a mini lockdown or a district lockdown. Tell us how that is going to work practically, but also add to that the festive season that we're going into. There's going to be a migration. Most people in that province, they tend to go to the Eastern Cape, and that province is already dealing with a mess in terms of the second wave. How are you going to try and make sure that people with this virus do not transmit it and take it to another province, but also add to that the whole practicality around a district or mini lockdown? What does that mean in practice?
Okay, so the first thing is that lockdown can only be given, or it's a national level competency within our disaster regulation. What I've asked our team to go and investigate is what powers do we have in a province, and what is the new kind of innovative stuff that we could use to slow down the spread of this virus. We've looked at what's happening in other parts of the world, and what they call in Australia. They also call it in Singapore a circuit breaker. And that's, I suppose you could call it a mini lockdown. It's basically focusing into an area. Obviously, we don't have the power in which to implement that. But within that concept, what can we do as a province? And that is obviously our healthcare services continuing with doing what we have done in slowing down the spread. Law enforcement is definitely where we do have competency. So how do we use law enforcement, traffic officials? How do we use local law enforcement and linking in with the South African police services to slow down the movement of people, to make sure people are adhering to the level 1 rules that we have at the moment, the social distancing, the mask wearing, the sanitizing, hand washing, etc., which are the basic, easy mechanisms to slow this virus. And we do see some fatigue in that system. And then are there any other innovations that we can use around communication? I think people are getting tired of the same message. So how do we use innovation and getting communication to change? And also just using the citizens' energy to say, we've done incredibly well over the last while with either just slowing the spread or feeding people who needed to be fed, people just getting up and doing the thing. We need to get that energy back in, and that energy to focus on the spread, so that at the end of the day, we don't have to, have a lockdown imposed on us at a national level or in a regional level. What is it that we can do? We still don't have all those answers, and we're looking for people to help us with those answers. And we will be having a cabinet today again on bringing some of those answers back into the cabinet space.
Sure. Finally, Premier, are you encouraging people to travel to their home provinces? In South Africa, we have what is called economic migrants. So I'm not a Joburger myself, but I work in Johannesburg. My parents are down in Durban. Talk to us about whether or not you are encouraging people to travel.
Okay, so at the moment we haven't we haven't got a position on it. Although there's quite a lot of travel expected now over this Christmas holiday season time. Two parts happen within our system. Many people go home, so people who come here for economic opportunity, work, etc., go home. And of course, as you said earlier on, in our neighboring province, the Eastern Cape, they really do have some serious infection rate numbers, etc. And so, I think people need to, at the moment, just make responsible decisions about moving around. And then, of course, we also, want people to come and enjoy our spaces for the season, the tourism offering. We've got that business app back up and running, and so engaging with those sectors to make sure that we've got the proper management systems to stop spreading. But we haven't taken a position to say we don't want people to travel. We want people to travel, but we want people to travel being mindful and conscious of the ability to spread with travel, and people need to be responsible at the moment in how they travel.
Western Cape Premier, thank you very much for your time. Winde talking to us about their plans to try and stop the spread of COVID-19.